Hello everyone, this is Bob Ranner with Community Coronavirus Update number 103. Today we're going to focus on why masks are needed in schools and all other public settings to prevent rationing of healthcare in the next couple of weeks. So today, a statement from Nebraska Infectious Disease Society. Our first recommendation as an organization is the masking of all students and staff in school settings. The problem, of course, is that the Omicron variant is probably the most contagious virus we've seen since measles, and this is the best chance our schools have of being open the next few weeks, because the last thing we want is our kids to be home from school, because they need to be there learning, not sick, and of course mom and dad need them there to work. And then the other thing, of course, is we need everybody to get out and get their booster vaccine, because we wouldn't be in this situation if enough people have gotten their booster vaccines. So what's going on? Well, here's the numbers in COVID Act now, and you may have remembered a few weeks or months ago where at the county level, most of the South was in the green and yellow range. Everybody thought finally after the third wave they'd, quote, reach natural herd. Of course, that's not happening. So if you look at hospitalization rates by state, they didn't start getting comparable data till September of 2020. So we missed the original New York surge here and the summer surge in the South. But if you go to Florida, which is the purple line here, they came after their summer surge. Then they had a winter surge last year, and again, people thought after the second wave, okay, now they're at natural herd. Then Florida had a huge surge a few months back, and everybody thought, okay, now they're at natural herd. Oh, now they're going back up again. As well as New York, and New York's now ahead of us. A lot of surges hit them first. You don't see, of course, the big surge they had originally, but even last winter, despite that first surge, they had another one, and there another one, and then I got Nebraska, Colorado, and Missouri are two of our neighboring states also heading up at the same time, especially Missouri, and we'll get to why that's a problem, especially for pediatric hospitalizations in a little bit. So, the problem, of course, at the end of the day, like I keep telling people, at the end of the day, the judge of who did bad or good is dead, not dead. And of course, Florida really, they were doing pretty well, but then last surge, here they go, and they're going to go up again. Maybe they'll catch up to Mississippi and Alabama. Many states have passed New York, despite New York's horrible surge initially. A lot of other states have not learned the lessons from them, and they're going up there. Thankfully, Nebraska's not too bad. We're still in the top 10, just barely. You'll see this big, I don't know, it's hard to see, but this blip is because Nebraska wasn't reporting this data the right way like the rest of the state. And still, if you go to the state dashboard, they're reporting this way, not the way everybody else is reporting in deaths. But, still, Nebraska's in the top 10. I'd really like us to stay there. So what's going on right now? Well, we have still a mix of Delta and Omicron, and so we actually haven't even finished our Delta surge, and now we've got an Omicron surge on top of that, and that's one of the reasons why things are doing so bad. This is at the national level. If we break it down at the regional level, you can see that it hit New York first. So if we want to see what's coming our way, we should look at New York. And then, of course, we also then can look at the South region because, first them, then them, then this is what's coming our way. We're not genetically dissimilar enough that we're not going to follow their pattern. So this gives us a good window about what we have to look forward to in the next couple of weeks. So Omicron questions, does it spread faster? And the answer is yes, probably as fast as measles. Does it escape infection or vaccine-induced immunity? And unfortunately, the answer is yes to both, especially if you haven't had a booster vaccine, but it really escapes infection-induced immunity. So people thought they were safe because of natural immunity. We are having documented cases of people having 3 and now even 4 cases of COVID because it's not permanent. The third question, though, is it more or less severe? And the answer is it may be less severe. It's looking like it's probably, but still a probable, of course, but overall likely worse still due to the larger caseload for number 1 and 2. And the way to explain that is, let's say the Wuhan strain is 100 in severity and the Omicron strain is only half as bad. People might say, oh, that's good, except that if it's 5 times as infectious and results in hospitalizations, even though it's half the hospitalization rate, because you have so many more infections, you would actually have a worse problem in terms of hospitalization rates, and that is exactly what we're seeing. So just because it might be a little less severe doesn't mean we're out of the woods. We're actually, because of the infectiousness, it's making it worse, and that's what you're seeing in hospitalizations across the country. And the other thing is, I'd say it's still probable because you can't rely on South African data yet, because South African data may be misleading because they're younger, they're less obese than us, and also they've had universal public masking, which we don't have. The other reason, this younger population is a big deal because some people will point out that Sarpy County, which is Bellevue, has a mortality rate just a little lower than Lincoln and Lancaster, and they're saying, well, doesn't that mean what Lincoln did wasn't necessary? Well, no, the answer is different because Bellevue has a younger population. They have much fewer elderly as a proportion of their population than Lincoln, so you'd expect them to have, probably 20 to 30% lower mortality, not just a 5 or 10% lower mortality. Plus, it's a military age population, so because of the SAC Army base, you have a lot of active military who should be healthier. And then the English data may be misleading because you have a similar age population, but much higher percentage of who have had their boosters. This data is getting old because it's hard to unfortunately find new data, but England did a really good job of getting their elderly boosted as soon as possible, whereas Germany and the United States are laggards in there. I don't have recent data of this, and our health department unfortunately doesn't even report this, which is, I think, a failing on their part to not report this. Another way to look at it, of course, is Bryan Medical Center. When you look at all their people in the hospital, they're either unvaccinated, vaccinated, or have a booster. There's hardly any people with boosters in the hospital. And the critical care docs have been telling me that most of these people are people who who are either transplant or cancer patients. So they've got a reason why the vaccine might not work. Other than that, they're not seeing healthy boosted people in the hospital. So Omicron severity questions, I think the best comparison for us to what is going to happen is what's happening in New York. And unfortunately, you're seeing a large increase in hospitalizations for all ages, but especially for pediatric hospitalizations, which makes me worried, especially given my school board hat. So if you look at nationally hospitalization rates, our biggest peak was last winter, had the fall peak, but it looks like this could end up nationally be exceeding our last winter peak. However, if you look at New York, where Omicron is hitting first, you'll see that they've actually already exceeded their last winter peak. This is HHS Region 2, which is New York and New Jersey. But the other concern, you look at this little yellow line, this is pediatric hospitalizations, which have been very low, except, look at this uptick right here. And so what you're seeing in New York and New Jersey is just the amount of pediatric hospitalizations is far more than they predicted. If you look specifically like that, this is where they are now. So, way worse. When you say 5 times, so far 5 to 6 times as many pediatric hospitalizations hasn't stopped yet. So we don't know how bad this is going to be in terms of pediatric hospitalizations, which is my big worry right now this week. So, you look at that whole area to the southeast of us that was supposed to have hit natural herd 3 times now. Well, they haven't done it. So look at this, all this bright red down here, as well as New York. So these people are now following these people and what's happening in their hospitalization rates. Well, if you go down to HHS Region 4, which is those regions, you'll see that peak hospitalizations are headed to as bad as they were a few months ago, and as well as their pediatric hospitalizations. So this is their pediatric hospitalizations. They had a high peak when they sent all their kids to school without masks in August. Now they may be exceeding that because of Omicron this month. We don't want to repeat that. So, because even now, even in our region, where Nebraska is in HHS Region 7, we're already at the highest level of pediatric hospitalizations we've seen so far. This is a problem because Children's Hospital, when I checked with them on Saturday, 2 days ago, they're full. Well, if they're full, where are they going to send anybody? Well, if the only other places with that high level of care are Des Moines, Kansas City, and Missouri, and unfortunately they're going to be full too. So there's not going to be a place to send these kids now that Children's is at capacity. So the worst thing we could do right now is send all our kids to school without masks because there's just not enough space for those kids that get sick. The percentage is going to be low, but the absolute numbers, we just don't have space for them. So here you are in Nebraska. We're already at the problem where Lincoln, our hospitalizations in Lincoln, 130 are the highest they've been since last surge. In Omaha, which almost was headed to the peak, thankfully got a little lower. Now they're headed back up again as well. And so those case rates can be predictive of your hospital rates, not one-to-one, but it is a good indicator. So we had this first surge that happened in August, September, put us up in this range, which was straining our hospital. Then we had the surge post-Thanksgiving, which put us in this range. What's this post-Christmas and January surge going to end up over here? We could be up in this range, and I don't know what the hospitals are going to do when they hit that. So it's starting to look really ominous for our hospitals, for adults and kids. So we could be hitting crisis standards of care for adults and kids. What does that look like? That means your dad may get treated for his heart attack in a tent outside the hospital because there's no space anymore. It means if your family's in a car wreck this winter on an icy road in the middle of Nebraska, they may have to treat your family's injuries the best they can in the small town ER where you are, and that's just going to be the best you can get. Or your grandkid may be sent to Denver or Kansas City for hospital care, or just left in the emergency room at the hospital they're at because there's no space in Denver, Kansas City, or Omaha. Do we really want to look forward to that? I don't. I hope we don't. So I think we need masks in school, and that's why we're going to start that way, at least in Lincoln and Omaha. Hopefully others will follow that lead. Essentially the reason I left this in there, and specifically Missouri and Colorado, is if our pediatric hospitals are full, well, Denver, they're heading that way. Kansas City, they're already above us. So there's not going to be a place to send anybody, I don't think, in another week or two. The other problem, of course, is the burnout in healthcare. And so what I'm hearing from the folks that I know that work in the hospital, this is a great blog post from Kevin MD, so I've linked to this. It's titled The Death of Empathy, because with their burnout, they've got nothing left to give, and it's getting harder and harder for them to care for you. They want to care for you. They want to do the right thing. But this is a tough environment for anybody working in a hospital right now. Encourage you to read it, but this is the situation we've put our hospitals folks in, and I'm not sure how they're going to handle the next month. And then it just gets getting uglier too. So Westside Superintendent Lucas, he's already getting threats because they announced masks. We'll see what our announcement here at LPS today brings as well. I wouldn't be surprised if we start getting similar threats. But we need to get past this, and I don't know where the end is. So for those of you who listen long enough, this is the last thing I'll talk about, and I'll wax a little philosophical and political here. I don't know if you know, but I was a philosophy major in undergrad. I'm really liking George Willard's columns these days, and this reasoned opinion that in an acrimonious time we need to learn a little bit from Socrates and how he learned to have civilized arguing. The Plato's Five Dialogues is part of what made me a philosophy major in college. Progress comes through dialogue, not monologue, and I think that's the biggest thing we've forgotten in society. As a school board member, I get hundreds of emails and complaints and things like that, and usually what I say to see if it's real or not is I say, well, do you want to meet for coffee? And we'll talk about it because this is a complex issue, and we're probably not going to solve it through comment sections or an email. In 2 years, I've only had 4 people take me up on that, and so I think we're a society that's too prone to just doing monologues. People like to do their 5 minutes of public comment where there's no real debate or anything. Our founders created a representative system of government where you have an elected official, and what you should do is talk to them. Monologues, whether it's in the social media commentaries, Facebook, even the comment section, you guys know if you ever do delve into the YouTube comment section, there's the folks perennially like to put comments, but they don't even half the time identify who they are. But progress really does come through dialogue, and hopefully in the United States we'll start getting this and have people quit segregating themselves into different echo chambers and start talking to each other, because we're going to get back past this, because if you really, like I say, I'm really feeling bad for the folks in the hospitals and of course the people who are going to get sick and die in this next month. So hopefully this is helpful to you. Kind of a downer, but links to all those data sources. At the end of the day, I like the old NASA adage, "In God we trust, but all others must bring data." So here it is, and hopefully this is helpful, and hopefully we'll get past this, and please go out and get your booster if you haven't done so yet.